Yeah, any deformities like dislocation of your sternoclavicular joint, dislocation of acromioclavicular joint, shoulder dislocation, okay, which is the bone most commonly can fracture. The clavicle can fracture. So what happens in these situations? What do you think will happen to the shoulder? It's abnormal. Okay, look for the symmetry on the both sides. If it's abnormal, okay, that means the problem you have to look and examine what exactly the problem is. Either dislocation of this one, fracture of clavicle, separation of acromioclavicular joint, if there is dislocation of the shoulder, all right? Also inspect for atrophy of the muscles. What muscles can be atrophied around your shoulder joint? Your trapezius can go for atrophy, deltoid can go for atrophy, right? So inspect on both sides, see if there is any difference that you notice, any deformities that you notice, any atrophies that you notice. Very important. Okay? Yes? Okay. And also look for signs of inflammation. If there is a trauma, if there is any inflammation, you see signs of inflammation. What are the signs of inflammation? Redness, swelling. Okay? Very good. Edema. Okay, and tenderness, you would feel it when you palpate it. Okay, that's tenderness on palpation. Very good. Okay, so you want to palpate. What are the areas that you want to palpate with the shoulder? Palpate bilaterally the sternoclavicular joint, see if there is any tenderness, and palpate the clavicle. Okay, palpation of the clavicle, see if there is any tenderness. Ask the patient to tell you if there is any tenderness. Okay, and if there is any tenderness in the acromioclavicular joint, which can be due to the separation of the acromioclavicular joint, and see, palpate the capsule in the joint. There's capsulitis, that can be tenderness. Okay, and also underneath your acromion process, there's acromion bursa. Okay, see if you can feel it. You can feel it only by doing the passive extension. Okay, and also feel for your greater trochanter here. If there is, why do you have greater trochanter tenderness over the greater trochanter? If you're rotator cuff injury, and also feel for your biceps tendon in between the greater tubercle and the lesser tubercle. Okay, feel the tendon between your fingers and the humerus. All right, good. So this is the general palpation. Do the same thing on the other side. Okay, it's bilateral. Do the same thing on the other side. Okay. Then what are the other things the specific things that you want to palpate for? Now I'm going to check for subacromion bursa tenderness of the subacromian bursa underneath your acromion process. Palpate by doing the passive extension of the shoulder. Okay, passive extension of the shoulder. Feel for tenderness of the subacromian bursa. Okay. And how do you test for the tenderness over your greater trochanter? Do the same thing. Again, passive extension. You do it and palpate on the greater trochanter. See if there is any tenderness. If there is any tear to the sits muscles, there could be tenderness over greater tubercle. Okay. And you want to check for the tenderness of your biceps tendon. Feel the biceps muscle go in between the lesser and greater trochanter. You can feel for the tendon. Okay, if there is any bicipital tendinitis, patient would complain of pain on palpation. All right, so this is. And what are the tests that you would do for acromioclavicular joint dislocation or arthritis? Ask the patient to raise his arm like this. Okay, and move it across the shoulder on the opposite side. Okay, if there is any dislocation or arthritis, patient is not able to do it, or he would complain of severe pain. Okay, that's called crossover test. Okay.
Then he does the active range of motion, right?
Okay, yeah. Then what is the test that you do? Again, what are the tests that you can do? There are so many tests that you can do for rotator cuff injury. What are the tests that you can do for rotator cuff injury? Drop arm test. Ask the patient to raise his arm or extend it, and ask him to drop it slowly. So if he could drop it slowly, it's normal. If he cannot drop it slowly, or he has to drop it immediately, it's called as positive drop arm sign. Is that clear? Okay. Then, what is the range of motion? The range of motion that you have to check for?
Abduction, adduction.
All the passive, active. Okay, first you can ask the patient to do active movements. Could you please raise your hands up like this? Okay, and put your hands behind your head like this. Okay, extending your elbows. Okay, what is this you're doing? Lateral rotation and abduction. Okay, put your hands behind your back like this. adduction and internal rotation. Very good. Okay, so those are the things that you can do. And if you want to do the passive movements, you can do the passive movements. This is flexion. Okay, this is extension. Okay, this is abduction, and you can do the internal rotation and the external rotation. Is that clear? So if you want to do it against resistance, it's the same thing. Ask the patient to do it and you resist the movement. Okay, that's against resistance. Is that clear? Okay, so if you want to do it, could you please try to move your arm out of body? Okay, bring it towards you. Okay, resist it. Okay, move your hand towards you. Okay, push it away. Okay, internal rotation, external rotation. Is that clear? And flexion is forward, extension is backward. Okay. Anything else?
Subacromial subdeltoid bursitis palpate.
Yeah, I did that. Subacromial burst. I did the extension and I finished. Is there anything else?
Bicipital groove tendonitis. You just palpate.
Yeah. Palpate the bicipital tendon in the bicipital groove.
So that's just one test,
So
right?
you're doing
2 in 1. Shoulder.
both shoulders.
That's one test.